So, the perception of CBD oil as a wonder drug for pain management and other things seems to be growing every day. But what do we really know about this? And is it right for you? Should you even consider this? So, we're going to talk with Dr. Igor Koterbash, co director at the Center for Dietary Supplements Research at the University of Arkansas Medical Sciences, and we're going to learn more about CBD oil. This is UAMS Health Talk from the University of Arkansas for Medical Sciences. I'm Bill Klaproth. Dr. Koterbash, thank you so much for your time. This is a really interesting topic. So first off, what is CBD oil?
Well, that's a very interesting question. Probably first we need to start what CBD is and then what CBD oil. So CBD itself is the non-psychoactive component of the cannabis sativa plant. So there's the THC or tetrahydrocannabinol, which is the psychoactive, right? And CBD or cannabidiol is a non-psychoactive component of it. Usually it's being delivered in the form of oil, and usually it's being delivered together with the sesame oil, which is being used as a vehicle, right? So cannabidiol itself is not really an oil; it's just being delivered in a form of oil.
So do you rub it over the affected area?
Usually, actually, this is drops.
Okay.
So that they are orally ingested.
Okay, so it's drops. And what do? You drop them in some water or something?
No, usually they go as a sublingual, so you actually put several drops in your mouth. But there are some creams now being also developed with CBD, and they have a little bit different vehicles.
Right. So this oil, I mean, the big question is, does it get you high?
So cannabidiol itself is believed not to make you high, right? It's considered as a non-psychoactive component. That said, when you extract cannabidiol from cannabis sativa plant, right, you're always facing some levels of tetrahydrocannabidiol, THC, which makes you high, right? Currently, when there is no current good manufacturer practices for cannabidiol, the majority of the products that on the market contain THC from small amount to some substantial amount. And when our colleagues at National Center for Natural Product Research at Ole Miss, Oxford, they did some analysis of the product. Some of them contain up to 45% THC, which is enough to make you really very high. So in other words, when you buy a CBD product, you always have to remember that there is a substantial chance you may fail the drug test.
So a lot depends on the manufacturer, it sounds like. So is this legal in Arkansas?
Yes and no. It is this kind of a gray area, I would say, right? It certainly depends on how you sell it. CBD initially has been approved by FDA in the form of a drug called Epidiolex. So if you sell it as a drug, right, you need first to seek the FDA approval. FDA clearly stated that CBD cannot be sold as a dietary supplement. So when you buy a CBD, which is with the label of dietary supplement, it's being illegally sold. If you are selling CBD, you are not allowed to make any claims like that to cure cancer, arthritis, and any other disorder it's being now touted to be helpful for.
So should you check with your doctor first before starting to take CBD oil on your own?
It is clearly a great idea to talk to your doctor before you take any medication or anything you take, right? And you definitely, if you decide to take a CBD oil, it is, first of all, you need to talk to your doctor about it and hear what doctor says about it. Second, doctors need to know about it because CBD has very high potential to interact with other drugs. That means that it can either negate the positive effects of your drug, so your drug is not going to work, or it can actually make the drug work even stronger or increase its toxicity or negative side effects of the drug. And certainly the doctors need to be aware if you have some prescription drugs and you want to take CBD, it's very important to let doctor know about it.
So we hear about CBD oil being used for pain management. What are some of the other conditions someone may use CBD oil for?
To my knowledge, the effectiveness of cannabidiol has been shown in treatment of some therapy refractant forms of epilepsy. It's the pediatric syndromes like Dravet syndrome. These are severe forms of epilepsy that are resistant to conventional therapy. But Epidiolex, the drug, which is based primarily on cannabidiol, has shown very promising results. To my knowledge, this is the only one purpose where effectiveness of cannabidiol has been proven, including clinical trials. There is no other purposes or positive health effects that have been convincingly demonstrated in terms of for cannabidiol.
Okay, that's really good to know. But for sure, we know that there has been tests, and it does prove valuable for the treatment of epilepsy. So now you're a researcher, Dr. Coderbush. Can you talk about some of the interesting things your research has found with CBD oil treatment?
Yes, so we did a number of studies, and we continue actually those studies using the animal models, right? Because technically, before you try to give something to people, you need to make sure that these drugs or the supplements or whatever we're going to call CBDs are not only effective but also safe. And so we conducted a set of studies, first of all, looking at toxicity of CBD, right? In other words, whether it can cause negative health effects, because all those claims are, that CBD is non-toxic, and even at high doses, it's been safe. What we have found that no, CBD is not safe, especially it may hamper your liver health. And if you look at the label of a drug, Epidiolex, that was developed to treat epilepsy, it has in very large letters on a label, it says warning, potential for severe liver injury, right? So you need to monitor your liver health. And according to clinical trials, 5 to 20% of study participants develop elevation of liver enzymes, suggesting that liver has been negatively affected. We saw the same in animal models. In mice, we investigated the kind of like margins of at which doses you start seeing toxicity. Certainly, the very big question is the chronic low dose exposure, right? When you give one time, your liver, can be very forgiving. When you start using lower doses, but for a long time, no one knows. And this is one of the major interest in our lab, actually looking at the effects of the prolonged low-dose exposure to cannabidiol. We also look into the drug interaction potential, as we saw that cannabidiol can interact with many drugs, and we have recently published a study showing that co-administration of cannabidiol and acetaminophen, which is major liver toxicant out of all the drugs known, that co-administration of cannabidiol and acetaminophen can result in liver injury. So such things, really very important to know, because cannabidiol is being used for pain management, for example, right? And acetaminophen is present in like a Tylenol, right? Or once again, a drugs that actually being used for pain management, right? So we have to be very careful when co-administering cannabidiol with other drugs.
Well, that is really important information. We just don't know about the drug interactions yet and the effect it'll have on potentially someone's liver. And as you say, we don't even know yet if this is really right for pain management, although a lot of people are flocking to it to help them with pain management. The only thing we know for sure is that it has shown to help epilepsy. So really good information, Doctor. Thank you so much for your time today. We really appreciate it.
Sure. Thank you so much. My pleasure.
And for more information, just visit uamshealth.com. And if you found this podcast helpful, please share it on your social channels and check out the full podcast library for topics of interest to you. This is UAMS Health Talk. Thanks for listening.